everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Everyone, and welcome to the Dr. R Show. Today we're going to be talking about cutting edge stuff. We're going to talk about circumcision, a topic on the tip of every guy's mind. And if time allows, we'll go further upstream and talk about big prostates, where size really does matter. Circumcision is a very interesting and controversial topic. It has been around a long time and is at least as old as Abraham and his covenant with God over 5,000 years ago. To help explore this topic, we have with us today Dr. Jeffrey Nuss. Dr. Nuss is a urologist with the Urology Associates of North Texas and specializes in reconstructive urology. Dr. Nuss, what is reconstructive urology? Is it the equivalent of plastic surgery on the genitals? And how does it relate to circumcision?
So reconstructive urology is not exactly the same as plastic surgery, although we do use some of the same techniques, such as skin grafting and things like that. But mainly, my focus is to reconstruct the actual urinary tract, which is inside, so it's a little bit different. It wouldn't be actually cosmetic, but functional. It would be more important for the urinary function.
So that is a very special subspecialty of urology. As I understand, there's only 2 surgeons in the Dallas-Fort Worth area that do this, and you're one of them.
Yes, sir. There are only, to my knowledge, in the Dallas-Fort Worth area, there are only 2 fellowship-trained urologists in this specific subspecialty.
Yeah. Now, getting back to circumcision, what is circumcision?
Circumcision, like you said, has been around for a long time, ever since the ancient times, and it is the removal of a man's foreskin. There's a redundant portion of skin that covers the glands or the tip of the penis, and circumcision is removal of that to uncover the glands.
Now, why do we remove it? What function does the foreskin play?
Mainly protecting the glands from the outside environment, but really we don't have it doesn't have a major function in today. Why remove it? That's a good question. Many people will remove it for religious reasons. Other reasons would be for health-related reasons. The American Academy of Pediatrics recommends circumcision to prevent urinary tract infections, penile cancer, and to prevent AIDS or HIV transmission. But that's in very young boys, less than 6 months. Adult circumcision is much different.
Now, does the foreskin enhance sensation or diminish sensation?
That's a great question. I have many men come to me asking, well, should I get circumcised or not? Because I'm really interested in having an improved sexual experience. And what I tell men is that what you have is what you should have for your life. Because changing your foreskin or altering it in any way will likely not provide any benefit. And in fact, some men will complain that it's different and they don't like it. So I don't recommend circumcision for enhancing sexual performance or sensation.
Now, do men often come to you to get circumcised just for the cosmetic appearance?
Well, as I said, I don't routinely do that. I actually recommend against that. But when men do come to me for circumcision, it's mainly for a condition called phimosis, which is a tightening of the foreskin, preventing the glands from coming out, which can cause infection, and it can also cause painful erections and painful urination.
So men that have phimosis have had it for a long time, many years. Yeah. Why do they delay getting treated?
I think most men, as we're very sensitive, that's a very sensitive topic, and many men just don't seek treatment because they're either embarrassed, scared, or they're just plain not interested. But I think for the most part, men should seek out, if they're having problems, painful erections or irritation in their penis and they're not circumcised, they should seek consultation with a urologist.
Now, how was circumcision performed?
Circumcision is performed in the operating room. In adult, and let me take a step back. In the pediatric population, it can be performed in the office. As long as kids are less than 6 months, they don't have the sensation developed to have a painful experience. But in adults, it needs to be performed in the OR with a urologic professional, and basically incise the inner part and the outer part and remove it, and then reconnect the skin, the shaft skin, to the tip of the penis or the glands.
Now, in children, is it performed routinely still? Because the indications over the years, if you look back at the history of circumcisions, have gone all over the place.
That's a great question. So the answer is yes and no. The American Academy of Pediatrics recommends that it has numerous health benefits, as we mentioned before, but it's very clear that the decision should be left up to the mother and the father of the child. And so that is a personal decision, and everybody recognizes there are reasons for and against it, and so it would be something that both the mother and the father should have a conversation about and decide together.
And what is the current trend in regards to circumcision?
The current trend is to circumcise most men still in America. However, there are many people who are advocating against it for a lot of different reasons. Some, for the most part, most people who advocate against it feel that it alters the man in some way and may somewhere down the line predispose them to having some, what do we want to say, sexual encounter that's not as satisfying, or it somehow diminishes their experience.
And what's the potential complication of having a circumcision?
Potential complications would be shortening of the foreskin and just an altered cosmetic appearance as an adult. As a kid, you obviously will not know that what's the difference was as you grow up with it. But for the most part in kids, the potential complication would be shortening of the foreskin, which is really rare.
Any problems with infection or bleeding or anything like that after surgery?
Very rare, but can happen, as with any surgery.
When we come back, we'll talk with Dr. Nuss about BPH. What is BPH and what you should know about it. Stay right there.
I'm Megan and this is Christina, and today on Inside Fitness we're going to be focusing on free weight exercises. Now if you're a beginner, you can start on the machines, which give you a good guide of exactly how to do an exercise properly and to target that muscle that you're trying to work.
But if you don't have a machine and you're trying to do this at home, we're going to give you a couple of examples of some weights that you can do, or some exercises that you can do with some dumbbells to really kind of target and isolate those areas.
So we're going to start with a single arm shoulder press that Christina's going to demonstrate. So first I want you to stand with your feet about shoulder width apart, one hand on your hip, and then raise the weight up so your arm is about parallel with the floor, just a little bit higher right there. Now you'll see that she has a 90-degree angle in her elbow, palm should be facing forward, and then you're going to exhale as you press up above your head, and inhale as you lower it back down to that parallel position. You never want to go lower than parallel because that's going to strain the shoulder. So you're going to do about 3 sets of 10 repetitions of this exercise, and then you're going to switch sides. Now make sure that when you're doing this exercise, you're not rocking back and forth. You really want to isolate the shoulder and not use your body to help you with this exercise.
So perfect. All right, so moving on, the couple of things that we really want to let you know whenever we're doing free weight exercises is that you want to do multi-joint exercises before you do singular joint exercises. So what do I mean by that? What I was just going through with Megan was the shoulder press. So you can see I'm moving both my shoulders and my elbows, multi-joint. Megan is going to do a single joint exercise for us now, so if you want to grab your dumbbells. Okay, so for the frontal raise, what you're going to do is your palms are going to be facing you, and Megan, if you can go ahead and lift your arms up, you want to exhale as you lift your arms up. You always want to exhale on the hard part and inhale as you bring them back down. So let's go ahead and do that again. You can see how she's got that great 90-degree angle, a great posture, and her arms are nice and straight out. So once again, exhaling on the way up and inhaling on the way down, you're really isolating those shoulder muscles. So we're going to go ahead and move on to the lateral raise, which is basically the same motion, but we're going to do it off to the side. So go ahead and do a lateral raise for me. Once again, we see this nice, just kind of square corner here. Go ahead and inhale as you lower down. And we're isolating that single joint. So this is the difference between a single joint exercise and a multi-joint exercise. Perfect.
Now our challenge to you this week is to get your lifting on, know your limits, stay safe, stay hydrated, and we'll see you next week
On Inside Fitness.
Hey guys, I'm Megan and this is Christina, and today we're going to be discussing two common terms when talking about eating, and that is hunger and appetite. There are many different things that affect our food choices, and physical hunger is one of them. And that's when your body is actually telling you that it needs vitamins, nutrients, food, and then there's appetite, which is our desire to have food. And that can be affected by our mood, feelings, surroundings, and many other factors. So it's very important to be conscious of whether or not you're eating because you're hungry or because you just have an appetite.
Like, for example, when you're watching a movie or something and you go to grab popcorn, I can't watch a movie without eating popcorn.
Exactly. So it's very important to plan ahead and choose a healthy snack in advance. So today we're going to go over some roasted garbanzo beans, which are extremely delicious.
Now, this is something that you can actually replace your popcorn with, that is going to provide you with a little bit more protein. It's going to sustain you a little bit more, and it's still going to provide you with that sort of like healthy, snack where you're just kind of picking like you would with popcorn. So initially what we want to start out doing is you can go buy a can of garbanzo beans at the store. I got mine at Whole Foods. They're a little bit more all natural. They have a little less sodium in them, but you can pick basically any type of brand that you want. What we did is to get ourselves prepared. Let's go ahead and turn the stove on. You want to turn it on to sort of a higher temperature because you really want to get your olive oil nice and hot. So I'll show you a few things that we have here. We have garbanzo beans. We went ahead and drained them and we rinsed them. You want to make sure you do that. We've got salt, cayenne pepper, paprika, and olive oil. So once you have your stove kind of nice and hot, you want to go ahead and pour the olive oil in there, and you just want to let it kind of come to a little bit of a higher temperature. So I think we should be about good to go. Then what we're going to do is we're going to take our garbanzo beans, and you can kind of go ahead and throw them in the oil. What you want to make sure of is anytime you're pouring something into hot oil, you want to kind of point it away from you so you don't splatter yourself. Let's go ahead and pour the garbanzo beans in there. Okay, so we just poured the garbanzo beans in the pan. It's coming up to a nice temperature. You can see that our olive oil is bubbling here a little bit, and then what we want to do is just go ahead and flavor them. So the few things that I like to use are paprika, cayenne, and salt. So you just want to do about a teaspoon worth of paprika. We've got some cayenne. Now, if you're a wimp, you don't have to put a whole lot in there, but I love things that are spicy. So we put that in there, and then we've got a little bit of salt. I like to use sea salt, but you can use kosher salt or any other type of salt that you want. Then we just want to kind of stir it around a little bit, get all of those seasonings on the garbanzo beans. Typically what you want to do so that you don't burn it, because olive oil tends to get hotter a lot more quickly than something like canola oil. So you just want to go ahead and turn it down a little bit. And then we're just going to kind of keep stirring them until they're a nice brown sort of caramelized color. All right, so you can see that we've got a nice coating here on all of our garbanzo beans. We have all of our seasonings working. I went ahead and turned my stove off. We're going to kind of start letting it cool down a little bit. But one thing I do want you to make note of is that they're a little bit better when they're crunchier. So depending on the type of heat that you're using, you may want to cook them a little bit longer or a little bit shorter than we did today.
And crunchy foods can help satisfy both that hunger and appetite that we talked about, and crunchy foods will help you feel more satisfied a little bit quicker.
So let's put these in a bowl and enjoy.
Welcome back to the Dr. R Show. We're here again with urologist Dr. Jeffrey Nuss. Welcome back, Doctor.
Thank you.
Now it's time to talk about big prostates, better known as BPH, which stands for benign prostatic hyperplasia. Dr. Nuss, what is BPH?
As the term implies, it's an enlargement of the prostate due to a benign or normal physiologic growth of the inner portion of the prostate.
And why does the prostate enlarge like that? What causes that growth?
The main cause is, number one cause is age. as men age, we are going to get bigger prostates. That's a fact of life. That's how God made us. The main cause of that is exposure to androgens or testosterone. Over time, the prostate gland uses that as basically food and grows.
And when does BPH begin, and how common is it?
It's extremely, well, I'm sorry, to back up, answer your first question. It begins at around age 40, and as men get to that age, their prostates will start to enlarge. And it's probably going on for a lot longer than that, but it would become more common to be symptomatic after age 40, and then at age 50, 60, 70, it's very common to be symptomatic.
So it begins at age 40. Is it occurring really soon after we hit puberty and our testosterone levels increase, and then?
There is a certain amount of growth that happens, but certainly not anything that would become symptomatic before 40 to 50.
And how large is a normal prostate?
A normal prostate would be about the size of a walnut, and it can get as big as a grapefruit.
How long would it take to get that big?
Some men, not very long. So I've seen 50-year-olds with prostates the size of an orange, and they're just genetic factors.
And so if you have a prostate the size of a grapefruit, you can still walk and sit and ride a bike. And I would imagine that'd be hard to do.
Well, that might be a little bit of an exaggeration, but typically, because it's located deep within the pelvis, there's no external symptoms or pressure that you feel. The main symptom of benign prostatic enlargement would be urinary symptoms.
Any increased risk of cancer with such a big prostate?
No, that's a good question. Prostate cancer has a totally separate risk profile, and BPH, some men will come to me and ask, well, my prostate's enlarged, what can I do to shrink it so I don't have any risk of cancer? And I tell them prostate enlargement happens on the inside of the prostate. Prostate cancer typically happens on the outside of the prostate. Two separate places, two separate processes.
Is it different cells?
Different cells. Both cells can cause cancer, but due to some intricacies in the anatomy and cell signaling, the inner portion of the prostate, or the transition zone as it's known, is the portion that gets enlarged and causes symptoms and is typically benign. That's not the case all the time, but typically is benign.
Now, is the tissue different in the transition zone than the zones around it?
It is. The transition zone is what we call the adenomatous tissue. So the adenomatous tissue is the benign growth, and that is what the zone that is predisposed to abnormal growth that causes symptoms when exposed to androgens over time.
So the cells around that central portion of the prostate are different than adenomatous? They're a different type of cell?
They're all the same kind of cells within the prostate. They're located differently, and so they can become symptomatic. A man can become symptomatic from that much easier.
So, and now what are the symptoms of prostate enlargement?
That's a great question. The symptoms of prostate enlargement include, most are urinary, and so they include a weak urinary stream, noticing that when you're at the baseball game and you stand next to your neighbor, it takes you a lot longer to finish urinating than your neighbor. Other symptoms include having to go to the bathroom frequently, having the urge to go and not being able to make it to the bathroom on time. Those are some of the classic symptoms.
So now, if you have the urge to go and you can't make it on time, that means you're urinating prematurely. Why is that happening? If it's an obstruction to the urethra, you would think that you'd be delayed, not the other way around.
That's a great question. So there is a complex interaction between the prostate and the bladder. The prostate is a gland that sits right below the bladder, and when the prostate starts to obstruct the outflow of urine coming from the bladder, it can induce changes in the lining and the muscle of the bladder, which can signal to your brain that you have to go to the bathroom frequently, and you have to go now, which is like urgency. And so that complex interaction is what causes this constellation of symptoms.
And how do you diagnose BPH? Is there a test that's performed? Is there any x-rays, diagnostic tests, or is it a clinical diagnosis?
For the most part, BPH is a clinical diagnosis. perform a examination performed by a urologist or a primary care physician with a rectal exam, which is feeling the back of the prostate through the rectal wall. Also, the things that would need to be performed is a urinalysis and, more controversially, a PSA.
Now, can you have BPH and normal prostate on exam?
You can't. That's a great question. So symptoms do not always correlate with prostate size. Many men come to me and say my doctor's told me for years that my prostate is enlarged. And I feel their prostate, and it's very normal for their age. But they still have bad symptoms. And so we confuse those two terms. So small prostate does not always equal no symptoms. And so that's something we are still doing research on, what causes some men with small prostates to have more symptoms than others.
So in men with small prostates, they're just getting overgrowth of tissue around the urethra, and outside everything feels normal.
It's possible, but it could also be possible that they have a primary bladder process, like overactive bladder. I'm sure you've seen the commercials for many of the medicines on TV. That's a common condition in men and may mimic or be similar to BPH symptoms. And so having those kinds of symptoms, any man should seek help either with his primary care physician or a urologist to figure out whether this is a bladder or a prostate problem.
And so how do you treat BPH?
The primary treatment of BPH would be medical therapy. There are many good medicines out on the market now that are very good. However, some men do require surgery. There are different surgical techniques that can remove the prostate, ranging from directed microwave therapy to directed laser therapy. And it's a very exciting part of urology, and I enjoy taking care of patients because it makes a big difference in their lives.
Great information, Doctor, and thank you for being on the show. And thank you for tuning in today. I hope you've learned something that you can use to improve your health and perhaps even lengthen your life. Please tune in next week for another Dr. R Show, and until next time, healthy living and goodbye.